So, Ashley, obviously the cohort health plans and their peer organizations are going to be on the hook for coming into compliance with the this final rule. So, I wanted to ask what lessons you drew from the initial implementation, and what how that kind of informs your strategies or recommended best practices for other payers who are looking to implement a solution like this.
Yes. I I would say 3 specific lessons to me come to mind. So, first is just the importance of preparation for that 2027 enforcement deadline. I said it earlier when we began, and I'll say it again to you, our listeners. Um, Even if you think you might have a handle on the amount of work it will take to comply with these mandates, please be understanding that you are likely underestimating the amount of work. So you really must begin to start working on this now. You have to begin thinking about this now. Transferring member data to a health plan, after a patient provides consent for their new plan to obtain those records from a prior plan, it involves a complex technical sequence comprising 3 critical steps, authentication, member matching, and data retrieval. And in the absence of a robust data exchange system, payers might face challenges in responding to information requests or managing data from other payers, and that could lead to privacy issues and delays in critical decision making. So it's really important to really think through preparation. And I learned in the first few months of convening with the cohort work group, we did encounter numerous decisions that were not explicitly addressed in the mandate. So we had to navigate through these intricate details. We had to navigate through, some grayness and some uncertainty, which were not necessarily outlined in the implementation guide, but did require resolution nonetheless. Another example, I provided a few, but another example that comes to mind was determining whether to support mutual authentication for automated endpoint discovery or opting for an alternative solution was among the deliberations. And so while some of these details were implied, or suspected in the implementation guide, we did have to collectively make these decisions as a group. Second would be to test early and plan for time to iterate based on testing, because I think we all of us in product and development, we want to build something to be perfect, but you can't foresee every circumstance. So as we gathered with this cohort and initiated our preliminary discussions, the primary focus really shifted towards realizing our conceptual solution into a tangible reality. And so, we initially brainstormed and explored various features and capabilities that we thought would be suitable for our inaugural cohort. And while these discussions and interpretations were tremendously valuable, the critical question remained of how can we practically test and integrate our solutions? That was the end goal at the end of the day. And so hosting live testing workshops that resembled mini connectathons with our health plans was proven to be highly effective. And during our testing workshop, we made significant progress in validating that our service is functioning as expected. But even amidst our efforts to conduct tests, we did encounter challenges that we needed to work through together that underscored the complexity, again, that every payer is going to be facing should they be doing this on our own. And then I would say, building on this, that the third, lesson learned and kind of best practice that I would offer up is that that end-to-end testing really is crucial. So, during the May 2024 Connectathon, we observed that some vendors are still grappling with the basics, with authentication steps between their servers. And these observations, they highlight the pivotal need for payers to address these challenges. And through proactive engagement and issue resolution, supported through testing, health plans can really ensure they meet compliance standards effectively and maintain the smooth operations as deadlines do approach.